Am I audible? Am I audible? हेलो। हेलो।
Good afternoon, Stella ma'am.
Good afternoon, sir.
Good afternoon.
Good afternoon, Amsaka. I'm here.
Yes, that's good. Yes, yes. After a long time, we are meeting.
Yes.
Yes.
So these are full nurses, right?
Hmm?
This group is full of nurses.
I think so. It is by Trained Nurses Association of India, UP State branch, no?
Sir.
Good afternoon, Stella Madam. It's Raj from Nagpur. Yeah.
Oh
Hi.
my God! What a surprise!
Yeah.
Oh, really? It is you, huh? Okay. So you are now with this Samarpan group, huh?
No. I am actually joining as a guest, as Madam Dipti has called me 1 hour before to join the meeting. She told about the meeting about this palliative, no? That's why our kids are interested. So I joined.
Very nice, sir.
Huh?
Very nice.
How many years back?
In 2013, we were in
see.
the institute.
Yes.
Yeah.
11 years.
So you're still in Chandrapur? No.
No. I'm in Nagpur, Government Medical College, Nagpur.
Oh, good. I'm coming to Nagpur. Okay, month of
When?
August I'll be there.
Okay. We'll meet then. Definitely.
You have my number, right?
Yeah. I'm having. Yeah.
Okay, just send me a hi, then I will let you.
Okay. Yeah.
Is it time to start? It's already 2.
Yes,
I think
we
for me,
have to start
I have another session which I have to join by
3 o'clock, no?
Three
Nice, ma'am.
at least.
Hello, ma'am. Very good afternoon. Jai Hind.
Hi, Jai Hind.
Good afternoon, ma'am.
This is
Hi.
Dr. Deepti Shukla, Vice President, UPTNI State Branch.
Oh, nice meeting you, dear.
Thank you so much for accepting our invitation and being present in today's meeting. Thank you, Raj sir, for being a part of in a very short notice today. And Raj is my classmate also. Thank you so much, sir, for joining. Thank you, Hamza sir, for joining us. And others, Dr. Sahin, Professor Sahin Akhtar, madam joined. I think all the EC members, if they join, please open your video so that we can proceed. As madam is in hurry and she only given 1 hour to us. So we'll begin the session. Not session first, the inauguration session. Please open your videos.
And
Connect with all the classes. All are requested to connect all the classrooms with the students. Dear sir and madam, I would like to inform that our students, nearby 2,000 to 3,000 students in different colleges, they are sitting in auditorium. They are seeing together to you. They are going to attend your lecture together. So maybe in the participants list, there are only individual candidates who are attached. And other than that, they are in the group in the classrooms. Some you can see in the screen. Shishang, may I share my slide if you allow?
Yes, ma'am. I make you co-host. You can slide share, ma'am.
Okay, thank you so much. Just check Dr. Jaideepa R. Madam joined or not. She's today's chief guest.
No, ma'am. अभी तक जयदीपा मैम नहीं है.
Whether Dr. Rakesh Garg sir has joined?
I'm calling him also, sir. I just request to Praveen sir, please call, sir. I'm calling to Dr. Jaideepa.
Yes, Rakesh Garg sir is available.
Okay.
Good afternoon,
Welcome,
Rakesh
sir. Welcome, sir. Madam Pragya, you call Dr. Jaideepa's ma'am, then I start. Hello, ma'am. Please come online. Please. Sir, please give me 2 minutes. Others are also done and let it be completed up to 90 to 100. Mrs. Bhumika Singh is present over there, Secretary UPTNI State Branch. I'm not able to see you. Praveen sir will starting. Jasmine is there, will start. Let others join in between, no issue. Otherwise, it will be late. Yes? Professor Praveen, I'm audible to you?
Diti, you're audible.
Okay. May I start now, na? Because many joined already, no problem.
Fine. Please.
So thank you so much, Jai Hind, everyone, all the participants. Welcome to the second day of our international webinar series organized by UP TNI State Branch. And that is on our nurses, our future caring for the nurses, strengthening economic. And today is the second day, and these are DC members and these are our speakers. So today we have two speakers, Dr. Rakesh Garg and Lieutenant Elise Stella, madam. So we'll start with the virtual lamp lighting and the Ganesh Vandana.
नमो नमः मङ्गलमूर्ति मोरया
Dank.
Thank you so much. Now I request Professor Praveen Prakash, Chairperson Education Committee, TNI UP State Branch and the Principal, Metro College of Nursing, Noida, for the welcome note. Shashank, kindly unmute Praveen sir.
Yes, ma'am.
Hello, good afternoon to all. Am I audible?
Yes, sir, you are very well audible.
Yes. It gives me immense pleasure to welcome you all to today's webinar. On behalf of our DNI UP State branch, we extend our heartfelt welcome to each of you for joining us on the special occasion. We are honored to have with us a distinguished lineup of guests and speakers. Let me begin by extending our warmest welcome to our chief guest, Dr. Jayadeepa R., Principal, PSG College, Coimbatore, whose presence truly evaluated toward today's event. We are equally privileged to welcome our guest of honor, Dr. Muthu. One minute. Dr. Muthu, Vigneshwar Institute of Nursing Science, Hubli, Karnataka. We are also glad to have Dr. Shaheen Akhtar, whose presence is a source of great encouragement and inspiration. And our privileged guest, Dr. Raj K. from Maharashtra Vice President, DNI branch. A special welcome to Mr. K.V. Hamsa from DNipCare, who will be moderating today's session with his usual insights and expertise. We are also glad to have Dr. Rakesh Garg, our speaker for today's, who will be sharing valuable knowledge and insight during the session. And especially want to tell Dr. Rakesh from AIMS, Delhi. He is the anesthesiologist. His introduction, everything will be shared soon. And we are very much gifted to have sir for today's session. And last but not least, a warm welcome to Ms. Stella, who supports and coordinate have been integral to this event, where the DNipCare, they are going to give the role of the nurse in the future and current what they are doing on about in the palliative care. And to all our participants, thank you for joining us from different corners. Your enthusiasm and encouragement are what make webinars like this meaningful. Let's look forward to a fruitful session filled with learning, dialogue, and collaboration. And I want to, last but not least, and I want to welcome once again our technical team and our TNI UP State Branch members, EC members. Thank you. And once again, we are very warm welcome to all. Thank you.
Okay. Today's chief guest is Dr. Jayadeepa R., Principal, PSG College of Nursing, Coimbatore, Tamil Nadu. Madam has completed her PhD at Savita University and she also completed her MBA in Hospital Management from Bharatiya University, Coimbatore. She did her Master in Medical Surgical Nursing and she also completed PGDHM from Ambala University. And she is an active member of, she presented so many health fundamentals programs in ICMR and her leadership programs works like nursing approaches to stroke management from NIMHANS. Ma'am is also pursuing other certificate courses in forensic science as a postdoctoral fellowship in nursing research from Jigna Foundation. In her career, she's playing many vital roles. As you can see, she's a principal and she is being examiner, inspectors from the INC and PhD guide for so many scholars. Ma'am is currently as a state president of Nursing Scholar Society of West Bengal State and also national treasurer for the Indo-Pacific Forensic Nursing Sciences. As an award, she has received Best Principal Award by Research India Foundation in 2025. She organized many international national conferences, workshops, and she have a number of membership you could see on the screen. And she is having more than 45 publication, including Scopus and PubMed indexing. Today, I welcome you, Dr. Jaideepa. If she is in screen, I request you, madam, to say a few words regarding today's program. She joined, either she requested to join after 10 minutes.
Yes, I joined.
Hello, ma'am. Welcome.
Thank you very much, ma'am, for the invitation. Hi. Thank you very much.
No
I'm
issue.
just
I know that you are very much busy.
moving into my office.
Yeah. No issue.
Got an emergency meeting.
You come till that
Thank you
I
very
will
much.
just you reached, okay.
TNI. Yeah, just reached. You just reached my office. Yeah. Thank you very much for the opportunity. And I really congratulate TNI UP State Branch for organizing such a wonderful webinars. So it is really my pleasure to be with you all on this Nurses Day celebration. Wishing a very happy Nurses Day to you all. So we know that our role is vital in healthcare. As administrators of education institutions, we prepare the nurses. They are going to serve again the country. So on this occasion, I extend my heartfelt, sincere greetings to each and every one of you. And this webinar is on which topic?
Palliative care today. Palliative care today.
Okay, fine. So palliative care today. Actually, I can speak a lot about palliative care. We all know that anybody's needs at the end of life, you can't even imagine what they undergo, what a human being undergo at the end, because nothing more. After that, there is no life. Some people will be taking it as a positive. That's all. The worldly pressure is gone. There is some peace is going to be. But for some people, there will be lots of frustrations, the family, the worries. So leaving all these things, you can't even imagine what the thought process of a person at the end of life. As long as we are active, we won't even feel, we can't feel the other's pain and other things. So palliative care is very, very, very essential. As a nurse, we really should know what the patient undergoes, what a family member needs at that time. So this is what nurses should understand. Many things books won't teach you. With your own experience, with your own ideas, with your own value system, you will realize what really life is. Losing a life is not easy for the individual, for the family, for the friends and all these people. So as a nurse, you should really keep that in your mind. Nothing, the approach, the attitude, what we show, the sympathy, what we show, our presence, a gentle therapeutic touch. These things really matters, and we should understand what actually is going at the back of the patient's mind. We should be skilled in mind reading. So if we can identify, sometimes patients will not verbalize everything, especially during the end stages of the life. So we should be able to have that skill in understanding, reading the mind, and we should understand what the patient undergoes. So if we are able to identify that, and if we are able to give answer to the questions, what is going at the back of them, so then that is really very much challenging. Present day nurses should have that skill. You may be expert, you may be having n number of qualifications, you may be having n number of publications, you may have lots of credits next to your name, you may be holding a very high post. Everything is a credit, you have achieved it. But if you can win any patient's mind, if you can provide comfort to a dying patient, if you can calm the mind of a dying patient, that is a real success in your career. This is what I feel. That is why we need humans. Otherwise, machines will do everything. Many artificial intelligence and other technology, they are trying to replace many human workforce. But still, this unique feature, what we have as a human, can never be replaced with anything, any machine. That skill we must build on us. So we must develop that. Young nurses should understand the value of being sympathetic, very basic principles of nursing. Only then we can success and survive in this profession. So as far as palliative care is concerned, our mind should be strong enough. Sometimes there may be lots of emotional drain from our side also. So our emotional intelligence, emotional maturity, everything matters. So young nurses may be a very young, 25, 26 years old nurse, understanding life and its process may be very difficult. But still, we should instill that character on us. So that only will be of very much essential, and we succeed as nurse only when we have that quality in us. So our nurses, our future, we are here to develop each other, as the true leadership means growing with everybody. That is what TNA does this. We are so much inspired with the vision and mission and activities of TNAI. So nowadays we see lots of growth in TNAI. I really appreciate your efforts in taking this. Thank you for the opportunity given to me. I am very sorry for joining very late. Take my apologies. But still, it was a last minute. So whatever came into my mind, I have shared with you. Wish you all a very happy Nurses Day, Nurses Week. Thank you. Thank you, Diti ma'am, for giving me this opportunity. Thank you.
Thank you so much, ma'am. Thank you so much being the part of today's session. Now I will carry forward. So today we have our guest of honor, Professor Dr. Muthu. Sir is a professor at Vigneshwar Institute of Nursing Science, Hubballi, Karnataka. As Sir is a president of NS Foster chapter in Karnataka. In addition, he is the MBA in hospital administration. He is working as a NABH consultant and clinical auditor, and he is a certified hospital for the certified hospitals. And he received many certificates and awards, such as he did his taught training for the many midwifery development programs. He is certified internal assessor for the Kalpana, NQS, Muskan, Lakshya program. He is also certified for Lean Six Sigma, that's green belt, yellow belt, and black belt. All the belts you are having, sir. Sir is a life member of many nursing associations and societies such as TNI, QCI, NTI, and SSS, etc. And he is a certified trainer for the simulation-based education from NRSA New Delhi, and organized many national and international webinars. Sir, you are here. I could have seen on the screen. Please say few words as we are in the hurry related to this topic. Kindly unmute. Muthu sir is there. iPhone Dr. Muthu PC. Unmute.
Thank you, ma'am. Thank you so much for a wonderful my introduction, and I'll take this opportunity to thank Deepti, ma'am. Really, you are a role model for us, ma'am, because every time we will be remembering you for whatever events what we do, ma'am. Really, you are a role model for everybody, actually. And about this today's event, ma'am, I really congratulate you, ma'am. Always, whatever you do will be a part of your as usually events. But really, this also I think it is very good. About this today's international webinar series dedicated to highlighting the vital role of nurses play in a global health system and economic development, centered around the theme of our nurses and our future, caring for nurses, that is strengthening economies. The event brings together healthcare professionals, policymakers, educators, and researchers to discuss strategies to support, empower, the invest in the nursing workforce. The series of emphasizes the importance of creating support work environments, improving nursing education and leadership, and recognize the economic impact of well-resourced and resilient nursing sector. Through expert talk, panel discussion, and collaborative dialogue, the webinar aims to inspire action towards sustainable health systems by prioritizing the well-being of the nurses. As already Jaideep ma'am covered what today's session is we covered, and thank you, ma'am. Thank you for giving me such a wonderful opportunity, ma'am. Thank you.
Thank you so much, sir. Thank you so much. You are very short and sweet and finish up. Thank you so much. Next, I will move for today's special guest. He's my friend and my colleague, Dr. Raj Kemodare, a PhD in child health nursing. He's also Vice President TNI Master Vidarbha region. Sir is working as a SNO, Government Medical College and Hospital, Nagpur, and he is also trained in the palliative care from the Palliative Council BCCPN course from Institute of Palliative Medicine, that is from Kerala. Sir, I humbly request you kindly unmute Dr. Raj. So say a few words regarding today's session.
Thank you very much, Dipti ma'am, and I am very much thankful and extend my thankful to the Samarpan group for calling this international webinar and conducting this webinar very successfully. And as I said, this is the day 2 for the program, and we are focusing on the palliative care. I am very happy to share my few thoughts about the palliative care. As I went in 2013 for the palliative specialization in Kerala, Madam Stella is our teacher. Actually, she has exposed us to explore us to the field of palliative care, and we are very happy to understand the feelings of the patient who are in the end stages. And the main goal of this palliative care is just to improve the quality of life of the patients and the family, and that is a very important. In that, we have as a nurses what we have to do the symptom management, emotional support to the patient and the family, the communication, the advocacy between the patient and the family and the healthcare team. Also, we have to advocate the patient wishes and the preferences at the end stage. And important part is to elevate give the relief to the patient from the pain what they are going through. The important aspect of the palliative care is also spiritual care, which is a very important factor in some patients. So the active total role of the patient where the disease is not responsive to the curative management is the palliation. So I am very much thankful to allow me to join this station, and I wish all the success and happy Nurses Day to the all participants and the nurses. And thanks. And over to you, Dipti ma'am.
Hello, ma'am.
Thank you so much, Raj sir. My connection was disconnected. Thank you so much for your word, and we are happy to have you here. I now welcome our next special guest, Professor Shaheen Akhtar ma'am. She's a vice principal and her specialty is community health nursing in Maharishi Vasishtha Autonomous State Medical College, that is a government college in Uttar Pradesh. I request Professor Shaheen ma'am to share a few words regarding today's session. Professor Shaheen is on a screen. Please unmute her.
Hello.
Yes, ma'am.
Am I audible, ma'am?
Yes, ma'am. You are very well audible. Please.
Thank you so much, ma'am, for inviting me today. Jai Hind and warm greetings to everyone present here. Respected dignitaries, esteemed speakers, colleagues, and delegates, on the occasion of International Nurses Day, it's an honor for me to be the part of this international webinar series organized by Trained Nurses Association of India UP State Branch in association with Rama College of Nursing and Paramedical Sciences, Kanpur, Samarpan Institute of Nursing and Paramedical Science, Lucknow, and Delhites National Initiative in Palliative Care. The topic for today's webinar is palliative care. I would like to extend my gratitude to the organizers for inviting me to share my thoughts on these critical aspects of healthcare. Palliative care is a vital component of comprehensive healthcare, focusing on alleviating suffering and improving the quality of life for patients with serious illness. By incorporating palliative care principles, nurses can improve patient outcome, enhance quality of life, and provide compassionate care to individuals and families facing serious illness. Today's discussion, I'm very sure that undoubtedly will shed light on challenges, opportunities, and best practices in palliative care. As Jaideepa Madam told, gentle touch and empathetic approach of nurses is very important. So as a nurse, let's strive to create a healthcare system that not only treat illness, but also support the well-being of patients and their loved ones. To all the participants, I wish you a thought-provoking and enriching experience. And thank you once again for having me today. Thank you, Deepti ma'am, for inviting me. And I wish a very happy International Day to all the wonderful nurses present over there. Thank you so much, Jai Hind.
Thank you so much, ma'am. So now, without wasting time, we'll go with this topic, palliative care and role of nurses in providing palliative care. So let me introduce today's speaker, Dr. Rakesh Garg, sir. We are honored to have you, sir. We are honored to introduce an esteemed expert in anesthesiology, onco-anesthesia, cancer, pain, and palliative medicine. Sir has made sustainable academic and clinical contribution in his field with over more than 350 publications in international and national journals, 25 book chapters authored, and 2 textbooks edited. His work has been widely recognized. He has served as the editor-in-chief of the Indian Journal of Anesthesia and the Journal of Onco-Anesthesiology and Peri-Operative Medicine, and as associate editor for the Journal of Anesthesiology and Clinical Pharmacology and Journal of Medical Case Reports. Additionally, he is an editorial board member as peer reviewer for the several prestigious journals. His teaching and training impact is immense, having conducted over more than 50 major workshops, including those on airway management, CPR, mechanical ventilation, and palliative care, and delivered more than 120 guest lectures. He has chaired academic sessions and served as a judge at numerous medical conferences. His areas of interest include onco-anesthesia, airway techniques, research, cancer, pain, and palliative care. He has been the recipient of several prestigious awards, including the ISA President's Award in 2021, 2017 and 2015 for his significant contribution to CPR training and research module. Dr. Garg, thank you so much for accepting our invitation and joining us and making us proud to have some learning from your side. I request you to say a few words before starting the lecture. Kindly unmute Dr. Garg.
Thank you so much, ma'am. Thank you for the kind words. It's a pleasure to be part of this important webinar today. Thank you so much.
Thank you, sir. Next, we have our next speaker today, Lieutenant Alice Stella Virginia, madam. She is Mistress of Health in Libya and the Sustainable of the Oman experience more than 36 years plus. We are honored to welcome Stella ma'am, a distinguished professional with over 36 years of experience in nursing, to this event. Her career was initiated with the service in the armed force at the military hospitals in Secunderabad and Jhansi, where she was commissioned as a lieutenant in 1986. Following the military services, extensive work was undertaken in the private hospital and with the Ministries of Health in Libya and Sustained of Oman. Her contributions in India have been most notable during the tenure of Government of Medical College, Kanpur, where she served from 2016 to 20, making the beginning of her journey in palliative care in 2007. A fundamental certification in palliative care was undertaken, followed by the continuous training, including the ELNC and EPEC courses. A national fellowship in palliative nursing from 2015 to 16 was completed, and she has since served as a trainer of both ELNEC and IPEX program. Our work has significantly contributed to the training of nursing and medical professionals across India, with key focus area including lymphedema care, bedridden patients, communication, and psychosocial support. Recognition has been received in the form of numerous certificates and international award in 2019 to 20 for the leadership in palliative nursing. We are blessed to have you, Madam Stella, here in this webinar series. Thank you so much for joining us. And we will like to have few words regarding today's topic before we start the topic. Please.
So my topic is on communication, and as it was said, our nurses are our future. So I would say our nurses are our future, very right. With that, our communication is also our future. Because if we don't have a good communication with the patient and the family, of course, we need to communicate with everyone, but including the patients and the families, our future also is going to stop. That is another thing. Because nurses are playing a vital role in our health system. So in order to have a very good relationship with our patients and families, and for a good outcome, we should improve our communication skills also. And for that, we need to be trained in that. Thank you.
Thank you so much, ma'am. And we have today's lecture moderator, Mr. K.V. Hamza sir. He's a retired senior accountant officer, Ministry of Finance, Government of India, graduated from Kerala, currently serving as a general secretary and palliative care volunteer with the DNipCare, associated with DNipCare, a registered volunteer group for palliative care since 2008. Voluntary experience including session on palliative care at various institutions, including the University of California, Riverside, USA, recipient of KMCC Social Service Award. Sir, we welcome you for today's session.
Thank you very much, ma'am. It's really an honor to be here on this occasion of World Nurses Day and World Nurses Week. So the assigned role is to moderate the session, though I am neither from the medical fraternity nor from the nursing fraternity, but I am not an alien to the palliative care, as I am doing it since last 17 years or so in an organization which has been set up by me along with our other friends. So just without going into the details, I think I would like to invite our speaker, Alice Stella Virginia, ma'am, and ma'am will be speaking on the communication. So without wasting any time, let us listen from her, because communication matters a lot, not only in palliative care or in healthcare, but even in your everybody's personal life. If you know how to communicate well, you are having a good family relationship as well. So communication is really a good subject, and the way Alice Stella ma'am takes it, at the same time introduction and on palliative care, it is to be taken by Professor Rakesh Garg sir. So these two icons of palliative care, they are our family members, I will say, of DNipCare, Delhites National Initiative in Palliative Care. So shall I invite ma'am straight away, ma'am?
Yes, please
Okay.
go ahead.
Okay. So let me request Alice Stella Virginia ma'am to talk or heard.
Thank you, Hamsaka, and thank you, the organization, for inviting me for talking about palliative care. That also on my topic is communication. Okay, so before I could start, I think Professor Dr. Rakesh is here. So Dr. Rakesh, because I have another webinar to join, because I have 1.5 hours session to take, And as you all know, communication takes at least it's 1.5 to 6 hours. That is communication skills, what we take in palliative care. Okay, so without wasting time, let me tell, actually, I thought of having a PPT and all, but I don't think it will be difficult now to do it. So when we talk about communication, whether all the nurses do know how to communicate with the patient and the family. What we do is we don't talk to the patient. We talk to the patient, maybe we won't talk to the family. Some people that talk to the family, they don't talk to the patient, especially when the patients are facing life-threatening illnesses and in end-of-life care. As a nurse, we are scared to talk to them because they may ask something and which I don't have an answer for that. So a training is very important in communication for the nurses. I don't say that's only in palliative care. Wherever you are working, whether it is in ICU or in the general wards, wherever you are in the OPDs, anywhere, all the health professions need to know how to communicate with the patient and the family because they are undergoing many problems, I should say, like psychological problems, physical problems, spiritual problems, social problems. And we need to know how to assess their problems. So if you have a very good communication skills, it means that you can assess a patient very well. And if your assessment is appropriate, they can get a better treatment. And nurses need to open their mouth also. Nurses are the voice for the patients. If you don't open your mouth for the patient, who is going to stand for the patient and the family? So the nurses should become strengthening the economy. Everything is good, but nurses need to open their mouth. They need to stand for the patient and the family so that they will get a very good treatment, otherwise a management. So without wasting time, I would just like to tell you, communication is why it is important. We all think in communication, verbal is what we usually use more than a non-verbal, and it's very wrong. We use more than 70 to 80% of our communication is non-verbal, which we don't realize. We realize it very, very late. So by the time what happens is usually many things goes out of our way. The way we talk, when we are talking, our expressions, our body language is the first thing which goes to a patient. Without your knowledge, your expressions, your face expressions, your eyes, everything talks to a patient. So next time when you talk to a patient, be very careful about your body language. What you are talking and what your facial expression is showing may be different. Okay. The second thing, never think a communication is very simple. Communication is always a complex thing. Because what I think and speak, maybe you people are sitting in front of me, you may not be knowing. And what you people are thinking at present, this point of time, I also don't know. So what is going inside our patient's or our family's mind, we can't understand unless you talk to them. So communication is not simple, it is always a complex. So when I come to the communication skills, the basic principles, very basic principles when we talk, very important to remember is first and foremost is non-judgmental or the positive regard to the patient. Positive regard, you need a positive regard to them. That is, to love a person, there should not be any backgrounds. It is just like that. Okay. Whoever comes in front of you as a patient, ABCD, just look at what their problems are. Okay. No caste and creed should be there. No white and black. Nothing will be there. I have come across when we had in one of the time, one prisoner was brought, one terrorist was brought, had a gunshot and was brought. Okay, and very well I was knowing what he is. But for me, he was a person who had some problem and who had come to us in a pain and with a gunshot. So I need to take care of that. Okay. The prisoner also same thing, done a very bad things in his life and he was brought to us. Okay. But for me, he was a person who had come to me with his problems, with his issues. Okay, so that is the first thing. Now, the second thing is empathy. Okay, sympathy is just showing off. That's all. Hi, I feel sorry for you. Why this happened to you and these things. But empathy is not like that. Empathy, you should have empathy because put yourself on their place and just think about it. If I have a pain, how I feel it or how I will show it off to others, how I will react if I'm having a pain, if a nausea and vomiting, for that matter, any symptom. Okay, so if you think that the person who is sitting in front of me, he is in pain, and I can understand his pain, that is empathy. So have empathy, put yourself in their shoes and see what they are undergoing. And that's the first thing one nurse needs to know also. So have empathy for the patient and the family. Not only that, because the family is the one who is taking care of the patient 24/7. In the hospital, you people will be taking over, but the family is there next to the patient. So take care of that patient. Taking care of the patient by the family is very important. So have empathy for the patient's family also. And the third thing is genuineness, truthfulness. Don't lie to the patient and the family. See, how to break bad news, how to break the news to them, how can I tell these things? That's all another part of communication. I'm not going to talk about that. Okay. Very important is the thing is, if you lie to a patient, for an example, patient is lying in a cancer ward and telling that patient you are not having cancer, patient very well knows that you are lying to the patient. Why you have to lie to the patient? Nothing is going to happen. Everything will be fine. You are again lying to a patient. Even some people, they say, oh, one year you will get 3 months, you will get 6 months, you will get, no, we are no one to give them the days and time. Anything can happen anytime. I don't know when I will die, then how can I give time to someone else? So truthfulness is very important. Never lie to a patient. And this breaking bad news is very important also, but you need a good experience in that, good training in that. How to break a news to a patient, to a family or a patient, that needs a good experience. Without that, you cannot just go and tell. So as Stella ma'am told that we have to be very truthful, and today you're going and breaking the news, and tomorrow everything will come on your head. Don't do that. I'm just telling this one. You don't know, you can just tell them, I don't know what is the real problem. You can just talk to the doctors. Otherwise, you can talk to the nurses also, senior nurses, who knows how to break the bad news. Okay. Now, as a nurse or as a doctor, whatever health professionals, we face a lot of problems. We face a problem when we are talking to the patient. And what we face the problem is, we may think how to convey to them these problems. What could be their issue? Why I need to tell them all about their problems? Does it matter or not? Okay. Language is a problem, I tell you. Language is a problem. Dialect is also a problem. Okay, every state, they have their own language, and dialect is also so different. Okay. The third thing is, at times, we feel that if I tell something, I will be blamed. Okay, so it's better to keep quiet. Now, the very important thing is, as a health professional, we use medical terms. As soon as we step into our nursing or medical profession, we forget that we had come from a very simple language. We were a very simple language person. Forget about that. We start talking in medical terms, which the patient doesn't follow. We need to talk to them very simple terms. And of course, not only in the simple term, what I'm talking, that language which they know. If you don't know their language, try to find out someone who knows their language so that they can talk to them. That is this one. So these 3 points are very, very important. Now, as the previous speakers, one of them said that there are some basic things when we talk to the patient. One is touch, of course. Touch only if it is appreciated. If touch is not appreciated, don't go ahead with that. Okay, Gender problems are, a lot of gender problems are there. So we have to be very careful. Many times the patient gives cues also. If I touch here, patient may do like this. They won't allow us to touch. So touch, face to face, eye to eye contact. And again, eye to eye contact, not for all the patients. Some patients may not look at you. They may be just talking to you, but they won't look at you because they know if I look at you, I will lose my emotions. Okay, so maybe that is another thing. And don't interrupt unnecessarily when the patient is telling the patient's story to you. Patient is talking to you about their problems. Maybe it's physical, psychological, social, spiritual, anything it could be. Okay, just listen. Patient is talking about pain and you doesn't want to know about that. You are asking the patient whether you slept in the night. No. Patient is much talking about psychological. Just listen to the patient. God has given us 2 big ears and 1 small mouth. And we forget, we think we have 2 big mouth and 1 small ear. No, just listen to the patient. Just take all the history from the patient. After that, if you want to ask something, you can just ask the patient. And it's not only physical, psychological, social, and spiritual problems you have to address from the patient. Okay, document it correctly. What the patient, in patient's own language, it will be very good also. Document it correctly so that they will get a good management or a treatment. Okay. Interrupting in between always loses confidence in the patient to talk to you because they will be talking in a flow. Suddenly, if you interrupt, it becomes a problem. If you have time, tell the patient, you can talk to me. I have time. I have just come to you to talk to you. That's all. But if you feel you have only 10 minutes, in that case, tell the patient, see, I can't spend a lot of time with you. I need to leave. So just tell me what is your main problems. And the next tomorrow, or maybe if the patient is admitted, you can tell, when I am there on duty tomorrow, I'll talk to you. Now, again, when we are talking to the patient, remember your body language also. If you are sitting and talking to the patient, well and good. If the patient is lying down, you can just go near to the patient, sit near to the patient and start talking. And if the patient is in an OPD or something, see that you sit near to the patient face to face. Okay. Then, once the patient finishes the talk, okay, whatever problem, okay, just see what are the priorities of the patient's problems, and then now, just tell the patient also, see, these are the things what you told me. So anything left, the patient will highlight to you. This thing I told you, it is not. Okay, so these things we have to keep in our mind and always tolerate silence of the patient. If the patient becomes silent in between, do not ask the patient why you are silent, why you stop talking. Patient is crying, allow the patient to cry. Don't interfere in between because the patient, because main time, why, you know, when we cry now, we feel better. That's the thing. Okay. So in between the patient is crying, you are saying, hello, don't cry. That's all. Okay. So don't do that. If the patient wants to cry, family wants to cry, let them cry. Give them time. Then you can ask them whether you are able to talk to me further. Otherwise, we can keep it to some other time. Okay. Don't be harsh to the patient. If the patient, family or patient, they are losing their temper or anger, just leave it like that. Okay, they are angry. You also don't, lose your temper because then you know what happens over there. Okay, we need to control our emotions and we need to try to understand their emotions also because they are undergoing the problems. So stay with them, find out what happened to them, why these emotions, that you can find out. So that let them open. And in one sitting, maybe you cannot finish communication. Maybe you need 1 or 2, 3 sessions with the patient so that the patients can tell you about their problems. And the last, always gather all the information about the patient and the family. That is very important so that you can sit with the patient because you have all the information and you can talk to the patient. How is the patient? How is the patient's family? You need to know. Can I tell these things to the patient or can I tell these things to the family? So full information from the patient and the family, you have to gather and then only go ahead and talk to the patient. So I'm very sorry that I'm leaving. I would request Dr. Rakesh. With this one, I hope he will be talking little about the communication also, because it's already time for me, because I have to join for another session. Okay. Thank you all so much. Thank you, Hamsaka. Okay, I'm just leaving. Bye.
Thank you, thank you so much, ma'am. Really grateful for your brief but detailed thoughts on communication. So hope the students will learn much on the communication front.
Thank you
And,
so much, ma'am. Thank you so much. Our sincere appreciation for this talk about communication skill that nurses must have, that the nurses' ability to connect with this concept in the real life example that you given, that will definitely help them to connect with the patients. Thank you so much. I will feel very sorry that we were not able to connect immediately after the connection. So it's okay. Thank you so much. Definitely we'll have you again in our next session. Thank you so much, ma'am, for joining us.
thank you very much, ma'am. So before inviting Professor Dr. Rakesh Garg sir to talk on introduction and need of palliative care, I would like to tell few things, very few, out of my experience as a palliative care volunteer since the beginning of the organization of our organization, DNipCare, Delhites National Initiative in Palliative Care. It's a really wonderful thing that TNI established in 1908, having its presence in all the states and doing wonderful service. And we are really happy that the TNI UP state branch has taken this initiative, and the president Kumudini ma'am and vice president Dipti Shukla ma'am, all these people, and of course this Professor Praveen Prakash sir, I have seen him, I met him. Sir is of course in Noida and in UP only. So I had a long discussion. So many things can be done and needs to be done in UP. A lot can be done. Lot can be done. And, yes, this platform of DNA is a real wonderful thing, and we can do. And at the same time, I would also like to say that whatever the palliative care we are doing as a community-based palliative care and volunteers-based, it's a maybe a different model as such, unlike all other models available with so many organizations and government as well as private organizations. So whatever we are doing, and we are having this Professor Dr. Rakesh Garg sir, as well as Alice Stella Virginia ma'am, as our rather as our own family members, as I have told you earlier also. So they are always with us for conducting these kind of webinars and other sessions. And in addition, we are doing our palliative care sessions for the professional nurses as well as students, because as per the INC's guidelines, now the all the fourth semester students are to get in touch with the palliative care and the module, and understand the intricacies of palliative care. So we had been doing it for the Telangana branch, and then so many three batches we have already completed, and we'll be doing it. In addition to the nurses, it's not only nurses. It is everybody's business. Palliative care is not only nurses or doctors' work or responsibility or their role, but it is everybody's. So as such, we have now introduced palliative care for sensitization on palliative care for students of all, either college or universities, whichever stream they are. They need to know. Unless they understand the palliative care, the only nurses and doctors, whatever they are doing, it will not get disseminated to the lowest level. So this we have to introduce to each and every students, because they are the future generation, and they can participate in nation building. So without my blabbering, I would like to request Professor Rajesh Garg sir to talk his mind on introduction and need of palliative care. Sir.
Thank you so much, sir. Thank you so much for the kind words. And after the wonderful session by Madam Stella, we have learned a lot of important aspect with regards to the communication. So when we talk about the palliative care, it becomes important to understand that which are those group of patients which need palliative care and why are we looking for. Are there some specific cohort of population that needs palliative care, or it is in general any patients with chronic disease suffering from some debilitating illness, or those patients whether malignant versus non-malignant, or even to the extent nowadays we talk about the genetic disease, the disease which are chronic illness, but they have issues related to the routine management, that in spite of routine management, they have issues that they have some symptoms. And we do talk about the early integration of palliative care into these cohort of population. So this is what we are going to discuss. Just give me a minute so that I can share my slides also, so that you can see the slides and then we'll proceed further.
Mic off, na sir?
Sir, your voice is not audible.
Am I audible now?
Yes, sir.
Yes, sir. Yes, sir.
Thank you so much.
It's visible, sir. Your slide is visible, sir.
Can you just allow me to unmute also from the desktop which I've just joined?
Okay.
This is onco anesthesiology. Yeah, thank you. So when we talk about palliative care, we need to understand the importance of it and why do we need it. So maybe in next 30 minutes or so, we'll be talking about what is palliative care, why do we need it, which are those cohort of population in modern medicine when we talk about the curative intent, why these are important. If you see this patient, 35-year-old gentleman who had CA pancreas, he has received the treatment, and in spite of the best possible treatment, this patient now comes into your OPD, wherein the patient is complaining of severe pain in the abdomen, which is radiating to the back, and the patient is unable to lie down. The treating physician has seen that the disease has spread in spite of the best possible treatment, and the patient still having a lot of symptoms. Now, these are the group of patients wherein you need to understand that in spite of the best possible care, or when we say diseased focused care, these patients do have some symptoms, or the disease for which the initial treatment was started, the disease was not cured completely. In spite of best possible efforts, the disease either has recurrence or it has become metastatic. Now, these are the group of patients which definitely may not be get completely cured, but since like this patient, they will have a lot of symptoms, they will suffer a lot, and hence it becomes essential to provide them supportive care. And this is what the palliative care is known as, which was started by Dame Cicely Saunders way back in 1967. And for many decades, this has grown up across the world, wherein we have started giving them the patients, though with inclination of curing them, but we definitely to relieve and to comfort them in case even if we are not able to cure. And when we talk about cancer patients, almost 3/4 of patients come at stages where they are locally advanced, cannot cure them. And these group of patients becomes important for us to provide them comfort care, because a disease which is there inside the body will have a lot of symptoms, and these symptoms will be of various types. So when we talk about symptoms, it's just not the physical symptoms. We also talk about psychological, social, and spiritual aspects also. And this is what palliative care encompasses, all the domains of discomfort to the patient. Patient may be socially inhibited, patient may be psychologically depressed, spiritually depressed, in addition to the physical symptoms. And palliative care provides care for all those aspects, and that's why it becomes important. Here we are talking about not just one symptom or two symptoms, say pain, nausea, vomiting. What we are talking is total pain or total suffering management to improve the quality of life. So this is what the importance of palliative care is. And when we say palliative care, it is care beyond cure. So we are not saying that those who can be cured should be cured, but sometimes even if they cannot be cured, we have to care with these patients. And Dr. Ms. Stella has already mentioned that it doesn't require very high sophisticated equipments or infrastructure. It just requires understanding of a human person to understand the conditions of these patients, and using very minimal aspects, but very high empathy and understanding to give life to days and not days to life to these patients. Means we may not be prolonging life to these patients, but whatever the life has left, we are giving them a comfort care. And that's why in palliative care, we don't say, you must have heard when disease become advanced, it's recurrence, it's metastatic, people say, nothing can be done, take home and just take care of the patient. No, these patients would suffer. And hence it becomes important to provide them comfort. So we have always, there is something we can do for the patient and becomes important. When we try to say, do something for the patient, each patient would have different requirement, different need. So that's why we need to assess these patients. And when we say chronic disease, it could be organ failures like lung failure, renal failure, liver failure. It could be cancer patients. It could be neurological disease. And each group of patients will have different journey of their life when they suffer from chronic disease. If you see the first graph, which is for cancer patients, when the cancer is non-curable, they will succumb to death. In case the patient have organ failures, they will have acute exacerbation of symptoms, which needs to be managed. They come malady. In neurological symptoms, they will gradually have low function. The neurological functions will deteriorate with time, and they finally succumb to death. So this is how the journey will differ. And hence, we need to understand these patients well so that we can provide them care. Now, these are the group of patients who will receive palliative care. It's not just terminal cancer patients. Palliative care is for any patients with prolonged disease. It could be advanced cancer, it could be neurological disease, end-stage renal failure, end-stage respiratory failure, end-stage heart failure, end-stage liver failure, cancers which are recurrent, metastatic, or ongoing treatment. These are the whole group of patients who deserves to get some symptom support. And hence, this is what is palliative care is. When we start managing these patients, they will have physical symptoms like pain, dyspnea, neuropathic component, vomiting, diarrhea, constipation. We need to manage it. They can have social problems like financial. They will be isolated. There may be a wound which is smelling, making them more isolated. We need to take care of them. They may have emotional or psychological issues, sadness, anger, worries. Patient will be anxious about the disease prognosis. And again, the psychological components need to be taken care of. Spiritual aspects. They will be, why this has happened to me? what has wrong being done by me. So this type of spiritual issues also needs to be taken. So these are the problems these patients and hence to take care of. Physical symptoms, as you can see on the screen, these are the common symptoms that are shown by these patients suffering from chronic disease: pain, dyspnea, nutritional issues, nausea, vomiting, constipation, pleural effusion, malignant bowel obstruction, insomnia, delirium, drowsiness, weakness, and this needs to be taken care. So this is what we do for patients coming for palliative care with chronic disease. We make a patient-centered or a person-centered goals of care. Each patient will behave differently. Each patient will have different requirements. Each patient will have different symptoms. Some will have more physical symptoms. Some will have more psychological aspects. Some will have more depression. Some other will be anxious. And hence, based on the patient requirement, the patient need assessment, we make goals of care, and we plan and try treating these patients accordingly. And for this, we need a team of patients with their own role. And nursing professionals has an important role in provision of palliative care to these patients. In addition, you will also require physiotherapists, the dietitian, the treating physician, the nursing professional, the chaplains, the families, the volunteers, counselors, social workers. So these are the group of people who will be involved into the patient management, which is called as multidisciplinary team approach, so that all the symptoms, that is total pain, total suffering, which is inclusive of physical, psychological, social, spiritual, emotional, they all need to be targeted to take care of this. Now, another aspect is when we say about hospice and palliative care, it is sometimes people think it's one of the component where nothing can be done. A terminal patients requires palliative care. No, palliative care is something which encompasses the whole modern medicine across the specialty. Whether you are posted at nephrology ward, the medicine ward, the pediatrics ward, the obstetrics ward, the surgery ward, the chronic disease patient can be seen in any of these areas, and hence the whole specialty across different medical specialty, the palliative care can be involved. And when we start seeing these patients, the principles remain that these patients we affirm like try to make them comfortable. At times, we may not be able to cure them. Symptoms remains comfortable. We are able to manage the family as a team and thus try to increase the quality of life of these patients. It becomes important. The other important aspect that needs to be taken care in these patients is once they are advancing towards the terminal illness, we have to diagnose, die, and support them. Because when they die, we know that they are going to die, but this does not mean that we desert the patients. They may be bedbound, they may be semi-comatose, they may not be able to take orally, they may not be able to drink, they will have some pain, they will have some constipations, they will have some vomiting. So even at this stage when they are terminally ill, we have to support them. And this becomes important when we say good life. We also have to encourage that these patients have good death. Good death means these patients are not suffering when they have end of life. They have a comfortable death. They are not suffering from pain. They are not suffering from symptoms. And not only the patient gets relief, but the caregivers, the family members also becomes important. Now the palliative care, as I mentioned at the beginning, it's not the care of terminal patients. It is also the patients who are diagnosed with chronic illness. And over time, they will require, for example, those patients who are diagnosed with cancer, they will be treated. Once they are being treated, they will have symptoms, and that symptom is to be taken care of. So these patients who suffers from any chronic disease, we just not have to target disease-focused care. We also have to provide them comfort-focused care and then provide them a good death and take care of the family members subsequently. In addition, not just the physical symptom, but psychological, social, and spiritual support must also be provided, and that is what the palliative care is. Palliative care can be provided at any place. We don't need a separate, dedicated center for this. It can be at home, hospice, hospital, OPD, any specialty, any ward. The family members are happy to see their patients at home because they are taken care better, and hence home-based palliative care is also very well acceptable in Indian situation. And what we need to do is just to help them so that they can take care of the patient suffering from chronic disease at home. So we can empower patient, we can empower family members to take care. And when we start taking care of them, we also need to understand that in medical science, we have learned many things which are done for the patient, like CPR, total parenteral nutrition, putting them on ventilators, giving them blood transfusions, giving them total parenteral nutrition. But remember, when these patients are terminally ill, there is no advantage to keep them on ventilators in the ICUs. And hence we need to decide that what interventions in medical science is suitable for these patients who are suffering from chronic disease. If they are reversible cause, yes, we can do. But if they are terminally ill, we should try avoiding putting them on these life-sustaining measures. So to summarize, when we say the scope of palliative medicine, it is very wide. Any patients suffering from chronic disease should be offered palliative care. It can be given at any place. Multidisciplinary approach, home base is good, which affirms lives, promotes quality of life, treats the person, supports the family, and make everybody comfortable with a good life and culminating into a good death. The task of medicine is to care even when it cannot cure, and this is the basic philosophy of palliative care. At any point, we don't have to say nothing can be done. Everything, every time, something can be offered to make them comfortable, to make their quality of life better. And this is what palliative care is. And for this, we need education, the professional practice, the services, the awareness. And I'm happy that these type of programs where the palliative care now being included into BSCs and MSCs program. And when we have trained nurses, professionally trained, they can improve the standards, they can provide the services. And once people are aware of, they can take care of these services of palliative care so that they becomes better. So to summarize, palliative care provides a total pain relief. It is not euthanasia or it's not a dying process, but it is what? It's affirm life. And it takes care of the total management of the patient, total suffering of the patients. And a group of people with nursing professional having an important role can make these patients very comfortable, can improve their quality of life and make them not only a good life, but good death. And the patient and the family members, the caretakers, they also feel relieved that the patient is not suffering at any point of time. And for this, you can always learn these. They are basic competencies. And if you can learn, you can provide a good support to these type of patients. So thank you once again. And I'm open. We are open for any comments and any questions you want to ask. I would request Hamzaji to take a lead. And if there are any queries, I'd be more than happy to share or answer it.
Sir, thank you very much. But to add to this, it will be really great if you can just show light to the advanced care planning or living will. A few lines on that also, because all the nursing budding nurses or the nursing students, they are to have a role in it while dealing with the patients. Yes.
I think Hamzaji has said an important point, and with the recent Supreme Court order notifications, it has become important to understand the advanced care planning for these patients also. And also simultaneously, when we say the end of life care, we also need to understand, do not intubate, do not resuscitate these patients. So advanced care planning is when these patients suffer from chronic disease. And we know that these patients, when they suffer from chronic disease, they will have a time when they will become terminally ill. And at this terminal illness, say for example, a patient is suffering from CA lung. And CA lung has damaged both the lungs now. Patient is hardly able to breathe. He is not able to maintain oxygenation. Should we keep these patients on ventilators? Anybody can just unmute and say. Should we keep a dying patient with advanced disease on ventilators? Should we intubate them? If the BP starts falling, should we start them on inotropes, vasopressors like dopamine, noradrenaline, phenylephrine? When they are dying, they are not able to eat. Should we start them on total parenteral nutrition, insert a central line and give them total parenteral nutrition? Now, these are the important aspects, and this is what has come up as advanced care planning. So once we understand that this patient is advanced disease, now he has become terminally ill, we should not be putting them on life-sustaining measures. We should focus on the supportive care, the comfort care. And herein the court has come with notification that when the patient is okay, he can or she can take a decision that what should be done if this phase comes. So this means we are empowering them to take or make a plan in advance that how should they be taken care of if they suffer from this terminal illness. And in this situation, they can say that if this happens, they need not be put in ICUs, they need not be put on ventilators, they should not be on DPN, they should not be given resuscitation, they should not be intubated. So this is what is called as advanced care planning. Anybody of you, even in healthy phase, can take and give an oath, and you can make even an affidavit of something called advanced care planning, and they are structured format. And once it is done, and in case by chance, unfortunately, this thing comes, that advanced care planning comes into role, so that the patient who has a terminal illness is going to die is not unnecessarily suffering on life-sustaining measures in the ICU. And hence, this will take care of those unnecessary interventions which sometimes these patients are put on. And that's why this advanced care planning has become more formal now with the Supreme Court notification, which everybody can take care of it. And as a medical person, we need to honor them. We also need to understand and counsel at some point of time as you as nursing professionals. When you think that these patients are not going to survive, the primary care or primary treating physician has said that these patients cannot be cured. They have an advanced disease. These patients should not be intubated or put on ventilators. And hence you can counsel them, you can support them. That in case if this happens, nothing more invasive or nothing more life-sustaining measures should be offered to them so that they can have a comfort. And that's, yes, we have already discussed earlier that these patients, even they are terminally ill, we have to provide them support so that they don't suffer in pain, they don't suffer in nausea, vomiting, they don't suffer in other physical symptoms or psychological symptoms. That support system continues even if you are not able to cure them. So this is what is advanced care planning, and this is we sometimes as nursing professionals need to prepare the patient and the family members at the right time so that they can accept. Because if suddenly something happens, the whole family becomes panicky and then they are not able to take decision. So you can always help these patients to understand that since your disease is progressive, since your disease is not curable now, probably you will succumb to more symptoms. And in case if this time comes, we would like to just give you support so that you don't suffer rather than putting into ICUs on ventilators. And this is what is the broad concept of advanced care planning. And this is what the broad concept is end of life care. And hence we need to follow them up. Amjaji.
So it's the floor is for all the students as well as the faculties to pose questions either through chat or by unmuting themselves or through representatives, whichever way feasible.
Any comments or anybody who has sometimes seen some patients, provide them some palliative care, you want to share your experiences, most welcome. And I'll be happy if we can, rather than talking to the names, if I can see your good faces, it will be really good. So you can just switch on your videos and audios.
Yes, just request everyone to open your video. Raj sir here, Russell share some points because he is working with the same conditions and he can share his own experiences with us.
Absolutely, Dr. Raj. Yes, please.
Thank you, sir. And very good session you had taken. Actually, what happened sometime, what incidents I've faced in one case, that the patient is already terminally ill, and when we are giving him the symptomatic management to relieve the pain and all, the relatives are complaining, why you are giving this type of treatment, sir, why you are delaying his death. Such type of family members are sometimes complaining. You are increasing his life, and he is having so much pain. So the palliative concept is not actually clear to the people, and uh, the patient relative, what is actually, so we have to create more awareness to the family member also regarding the palliative care aspect. And it will not, and also we have to see the situation for the finance part also, because sometime when the patient is terminally ill, and as you asked in your session, that whether we have to continue the ventilation of the completely collapsed lung patient, so we have to uh, counsel and communicate the patient for their own financial help. We have to remove it from the ventilator, because it has to be not curing the disease, but it is delaying the process, and it will not helpful for eradicating the actual situation what the patient is diagnosed with. So this is my part from this side. Thank you, sir.
Yeah, I agree. I fully agree with you with your experiences. Sometimes the acceptability may not be good.
Yeah.
And that's why we say when we have used a word called early integration, once we start early integrating into a chronic disease, so once, say, for example, a patient is diagnosed with cancer, he may not require the advanced cares. We need not to explain him the advanced care planning, because this patient may be curative. But then this patient may have symptoms. He may have anxious. He may have nutritional issues, and that also becomes palliative care to a certain extent, or supportive care. So once we start early integrating, the acceptability becomes good. And in case if patient unfortunately lands up into advanced disease state, then once, since we have already have good rapport with them, it becomes more acceptable to those patients. And since we have provided them comfort care, the symptom support, the acceptability becomes much better. So the preparation always needs some time. And that's why when Mr. Hamzaji wants to say something on advanced care planning, this is what is called planning. So we are not doing at the last moment. We plan the patient so that if something happens, this needs to be done. So that's why we have to act at a suitable time. And that's why the palliative care worldwide is more focusing on early integration into chronic disease management. And once we start doing it, the acceptability becomes definitely better. Financial issues are here, but again, palliative care is benefiting them by taking financial care. If a patient does not need an ICU care, where the expenses may be 10,000, 20,000, 50,000, we know that this patient is going to die. He's having both the lungs studied with cancer. There is no survival. It's a terminal illness. Why should we put them into ICUs? And that's why when we start sending them at home and we provide them at support and they have comfortable life, this is again helping them financially by not spending money on them. Hence, at some point of time, it is making them more financially viable, make them less financially dependent on others, because they are not unnecessarily spending money for a futile intervention. So that's why we can always help them. And definitely, I fully agree, Dr. Raj, with you that they may not accept things for the first time at the last moment. And hence, we need to have continuous communication, which Stella Madam has just mentioned. And this communication is very important. Communication is not one step, one day, one time process. Communication is a sequential interacting with the patient and the family members at different time intervals. And hence, that's the importance of continuation in the care of these patients.
Thank you so much, sir. It was a brilliant presentation. Now I request Professor Jasmine. Yes. For vote of thanks. Professor Jasmine is there.
Good evening. Am I audible to you, Dipti ma'am?
Yes, yes, you are.
Okay, fine. Good evening, one and all gather here. It gives me immense pleasure to express vote of thanks on the second day of our international webinar series organized by TNAI Uttar Pradesh State Branch. On behalf of entire TNA UP State Branch, I express my heartfelt gratitude to Dr. Jaydeepa R, PSG College of Nursing Coimbatore, or for our chief guest, for gracing this occasion with her presence, and she shared such an enlightening thoughts with us, and it truly enriched today's proceedings. As a special note of thanks to our guest of honor, Dr. Muthu, whose inspiring address added the immense value to today's session. Again, we are also deeply honored to have had with us Dr. Raj K. Modgire sir and Professor Shaheen Akhtar ma'am for being a special guest. Your contributions and words of encouragement have truly uplifted the spirit of this academic gathering. I would like to extend our sincere thanks to our distinguished resource person for today's sessions. First of all, I would like to thank Dr. Rakesh Gar. He is an expertised hand in onco-anesthesiology, and palliative medicine. He very well narrated and he very brilliantly shared the deep insight into the need, scope, and sensitivity of palliative care. Thank you so much, sir, for sharing a few, these are very important to our nursing students. Thank you so much, sir. And next, I would like to thank Lieutenant Alice Stella Virginia ma'am from DNipCare. She delivered an impactful session on the communication, especially in palliative care. She already emphasized what is the importance of patient-centered care, how we can communicate with the patient, those who are in need. Finally, a special appreciation goes to Mr. K.V. Hamza sir, General Secretary, DNipCare, who skillfully moderated today's session and ensured a smooth flow of discussion. So this is really nourished our today's session. To our respected UP State Branch all executive members, our dedicated organizing team and technical support staff, thank you for your tireless efforts, seamless coordination, and behind the scenes, lot of dedication it's put forward. Last but not the least, a heartfelt thank you to all the participants from across India and beyond. Your presence and your perseverance, enthusiasm, and your interaction are what make this event truly meaningful and successful. Let us take forward for today's insights, what you gained today, and approach the upcoming sessions with the same spirit of learning and collaboration. Thank you once again. Stay safe, stay committed, and stay inspired. Jai Hind.
Thank you, Jasmine, for your words of thanks. Thank you so much. Thank you each one who present today for this wonderful webinar series. Thank you all the speakers, guests, and all the audience who are here. By missing tomorrow, we have another session that is on Nurses Make a Difference by Dr. Renu Susan Thomas. He's a President TNI Kerala branch. Principal, Valcare College of Nursing, Kerala. I request each and everyone don't miss to meet Dr. Renu Susan. She is an excellent lady and working so hard in the field of nursing. Thank you so much, everyone, to joining us today. And take care. Stay blessed. Thank you so much. Have a very good evening. Thank you so much.